Welcome to RN Osce learning sessions. Today we will be discussing Aed-Automated external defibrillator in detail. Automated external defibrillator, it's a lightweight portable device. It analyzes the heart rhythm and delivers an electric shock to help restore a normal heartbeat. It can be used in both hospital and out-hospital cardiac emergencies. Let's see the significance of AED. AEDs can deliver an electric shock to correct life-threatening arrhythmias such as ventricular fibrillation or pulseless ventricular tachycardia. It increases the chance of survival. It increases the survival rate if you can deliver within the first few minutes of cardiac arrest. That will greatly improve the chance of survival. AEDs provide voice and visual prompts, allowing even non-medical persons to perform life-saving interventions before emergency services arrives. It is accessible, it's available in public places, hospitals and ambulances, improving response time during sudden cardiac arrest. Once you receive the AED, open it and you will find both adults and child pads. Keep the pads close to the patient for easy access. The first and foremost step to operate an AED is to turn it on and follow the voice prompts. You will be instructed to apply the pads and connect the cables. You will hear accordingly as
apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Once you turn on the AED, you will hear the audio prompts like apply the pads and connect the cables. So you are supposed to place one pad just below the right collarbone and the other on the left side of the chest about 6 to 8 cm below from the armpit. For in case of a children, pads can be placed in the same position or one pad in the center of the chest and the others on the back between the shoulder blades.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Once you heard the audio prompts, you are supposed to apply the pads and connect the cables as given in this picture. Once the pads are attached and cables are connected, AED will announce analyzing the rhythm. At this stage, stop the compression and do not touch the patient. Once the pads are attached and cables are connected, AED will announce analyzing the rhythm. At this stage, stop compression and do not touch the patient. You are supposed to verbalize all clear, analyzing the rhythm. If the shockable rhythm is detected, the device will charge. When prompted, press the flashing orange light button and ensure that no one is in contact with the patient. You are supposed to resume the CPR within no time after delivering the shock. And if the AED advises no shock required, also resume the CPR without delay.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
All clear, delivering shock in 3, 2, 1.
Deliver shock now. Shock delivered. Start CPR.
The AED advises shock is delivered immediately without any delay. You can resume the CPR. If the AED advises no shock required, it could be a non-shockable rhythm. Also resume CPR without any delay. These are the special considerations for AED use. Ensure the scene is safe before operating the AED. Avoid using the AED on a wet surface. Dry the area before use. Remove any medication patches from the chest prior to the pad placement. You are requested to shave or remove the excessive hair to ensure good contact with the pad. Do not touch the patient during rhythm analysis or while delivering the shock. And always keep in mind, use pediatric pads for children whenever available. If unavailable, adult pads may be used in certain emergencies. AEDs are simple to operate. They allow laypersons and healthcare providers to attempt defibrillation safely. If you know the importance of using an AED as soon as possible, use it. It will increase the chance of survival from the cardiac arrest that is caused by an abnormal or irregular heart rhythm or an arrhythmias.